2.
Hi, I'm performing an epidural for my patient. I've already reviewed the chart. I've checked their INR, their platelets, their contraindications, allergies, and I've made sure the consents are signed. I've already administered fluids and preloaded my patient. Now I'm gonna put my blood pressure cuff on my patient, pulse ox, EKG leads, all ASA monitoring, and if indicated, fetal heart tones. I'm now gonna ask the patient if she can sit on the side of the bed and place her back in the position of a C. When she does that, I'm gonna palpate at the superior aspect of the iliac crest, and I'm gonna find L4. When I find L4, I'm gonna make a little mark with my fingernail so that I know that that's L4. At this point now, I'm gonna put on my mask in my eye protection and my hair cover, and I'm also gonna wash my hands before the procedure. I'm now going to prep my patient per the institutional guidelines with iodine, and I'm gonna start in the middle and with a lot of friction, work my way out. I'm gonna do that 3 times. Okay, and before I put on my sterile gloves, I'm gonna open my sterile tray. So I'm opening, and now I'm going to, I don't have sterile gloves, but I'm going to don on my sterile gloves with my dominant hand first. And at that, now that I'm sterile, I can touch the things in my tray, and I'm going to place my sterile drape on the patient. Okay. And now I'm going to get my kit together and using my filter needle. Where's my filter needle? So I would have a filter needle, and I would draw 3 cc's of lidocaine. Then my 5 cc syringe of, here's my filter needle. So I draw 3 cc's of lidocaine, and I would have an assistant that would be holding the ampules for me so that I'm not contaminating. So 3 cc's of lidocaine, 5 cc's of lidocaine and epi for my testos. And then in a 20 cc syringe, 0.25 of bupivacaine. And also I would have drawn up 2 cc's of saline in my also resistance needle. So now that I have everything ready, I'm going to take the smallest needle in the kit, and now I'm gonna tell the patient, make sure that she is in that C position so that I can easily see L4. I see my little skin mark. And now I'm going to start with the local in a cephalad position, and I'm gonna go to the side, the other side, and that way. At this point, I'm gonna take my 2E needle with the bevel up, and I'm going to keep advancing. I'm going through the skin, the subcutaneous tissue, the supraspinous, the inner spinous, and I should feel a crunchy sensation right now. So when I feel a crunchy sensation, the needle will sit in midline and not wobble. So I'm gonna remove my stylet And now I'm gonna attach my loss of resistance. And now I'm gonna slowly advance and advance. And then I lost resistance. I'm gonna note the depth of the needle, and it's at 12. Now I'm gonna have my catheter. And I wanna go 4 to 6 past 12. So it should be like around 16. And I'm going past the point of resistance. Okay, at this point, and I'm checking, now I'm going to pull the needle out and I'm gonna maintain my hand on the catheter. And now I'm going to attach my alligator clip so that I can okay. So now I'm going to have my test dose, and at first I'm gonna aspirate and make sure that it's negative for CSF or any blood, and I'm gonna administer 3 cc's of 1.5% lidocaine and 1 to 200,000 epinephrine. I'm gonna wait 3 minutes to make sure that it's not intrathecal or intravascular. And it's not, I didn't have a spike in heart rate. They didn't feel loose sensation. So now I'm gonna attach my 20 cc syringe. I'm gonna aspirate, again, no blood or CSF. And I'm now going to bolus with bupivacaine in 5 increments, 5 cc increments. Now I'm gonna secure the epidural catheter with the dressing from the institution, and I'm going to put the catheter with a PCP pump, and then I'm going to assess vital signs and the block level and document the procedure in the EMR.